You ever find yourself waking up at 3 a.m. like clockwork? Well, you're not alone. In fact, it is one of the most common sleep complaints among older adults. But is this just part of normal aging, or is your body actually trying to tell you something? Welcome back to Flip the Script. I'm Dr. Lee, and today we are unpacking why so many people over 50, and sometimes even younger, find themselves waking up in the middle of the night, especially around 3 a.m., and more importantly, what does it mean for your health? Well, let's start with the basics. As we get older, our sleep patterns naturally change. You might have heard the term advanced sleep phase syndrome. It's basically a fancy way of saying that your body's internal clock shifts earlier. That means you might feel sleepy earlier in the evening and wake up earlier in the morning. But waking up at 3 a.m. isn't just about bedtime. It's also tied to changes in melatonin and cortisol. Melatonin is our sleep hormone, and that actually declines as we age. Meanwhile, cortisol, or our stress hormone, tends to rise earlier in the morning. This hormonal combo can push you out of that deep sleep and into the lighter sleep around 3 a.m. So is waking up around 3 a.m. on a continual basis normal, or is that a red flag for something else? Well, sometimes it's normal, but sometimes it could be a red flag. A few wake-ups during the night aren't uncommon, especially as we age, but if you are waking up and struggling to fall back asleep or feeling tired during the day, it could signal sleep apnea, especially if someone tells you that you snore a lot or you wake up gasping. You could be suffering from restless leg syndrome, or you could be having issues with your blood sugar dropping overnight, which could be a common occurrence if you're diabetic or if your doctor's told you that you're pre-diabetic. Anxiety or depression, both of which could also disrupt sleep cycles, could also be at play. If it's happening frequently or messing with your quality of life, then it is worth bringing up to your doctor. Now, here's something interesting. In traditional Chinese medicine, the body's energy moves through different organ systems about every 2 hours. The time between 1 a.m. and 3 a.m. is said to be connected to the liver, and between 3 a.m. and 5 a.m., the lungs. So if you're waking up around 3, some holistic practitioners might wonder if your body is trying to detox, process emotions, or respond to unresolved stress. Even though that's not a medical diagnosis, it's an interesting lens to explore, especially if you notice emotional or digestive patterns tied to these wake-up times. But here's the good news. There are ways to improve your sleep even if you're waking up at 3 a.m. You can try to avoid alcohol close to bedtime because that can definitely disrupt your sleep patterns. Limit heavy meals late at night. Aim for consistent bedtimes and wake-up times to help support your circadian rhythm. Dim lights in the evening and avoid screens an hour before bed to help boost melatonin. And if your mind is racing at 3 a.m., try a calming practice like deep breathing, a prayer, or journaling keep a journal next to your bed. Also, do not check your phone. The blue light can actually signal your brain that it's time to wake up. So here's the bottom line. Waking up at 3 a.m. once in a while isn't usually problematic, but if it's happening every night, if it's lasting more than 20 to 30 minutes that you're up or causing daytime fatigue, then it's time to talk to your healthcare provider about this. Sleep is critical for memory, heart health, immunity. Basically, it touches everything. So if your body's waking you up at 3 a.m., it might be asking for a little extra care. Have you noticed yourself waking up at 3 a.m.? Drop a comment below and let me know what's helped you get back to sleep. And if this video was helpful, don't forget to like and subscribe for more faith-based natural health insights. See you in the next video.